Since its inception in the late 1980s, the Picker Institute has built on the concept that patients must be at the center of the healthcare picture, not just as the object of a medical procedure, but as an active participant in their care. From its headquarters in Camden, Maine, the nonprofit Picker Institute evolved from a vision its founder, Harvey Picker, and his wife Jean had for recalibrating the way physicians and their teams approach caring for people.
By and large, excellence of science and medicine wasn't always matched by good care. Patients might think, yes, I think I know that they're going to get the clinical parts right, but I wish they would look after me as a person as well. And that's really what started the Picker Institute down the road of developing means of measuring what actually happens, the patient's experience.
Led by its original team of researchers, the Picker Institute helped introduce the first scientifically validated patient experience surveys. With the 1993 publication of Through the Patient's Eyes and the subsequent DVD, a comprehensive examination of those surveys, plus on-site visits and patient and family focus groups, the Institute demonstrated how a patient-centered focus would improve the quality of care.
They come up with the first scientifically validated patient experience surveys.
Lucille Hanscom is the executive director of the Picker Institute. Under her leadership, Picker's 8 principles of patient-centered care: respect for patients' values, preferences, and expressed needs; coordination and integration of care; information, communication, and education; physical comfort; emotional support and alleviation of fear and anxiety; involvement of family and friends; transition and continuity; and access to care, have been ingrained into the fabric of our healthcare system.
It matters for their survival. Patient-centered care is related to whether or not your patient may be alive a year from now.
In 2001, the Institute of Medicine, the health arm of the National Academy of Sciences, adopted the Picker Institute's definition of patient-centered care in its landmark report, Crossing the Quality Chasm, which said it was one of 6 aims that would transform America's healthcare delivery system. But the Picker Institute's mission to improve the patient experience took an even greater step forward in 2009 with the advent of Always Events, an initiative aimed at significantly elevating the standard for the optimal patient experience in healthcare organizations throughout the U.S.
One of our key aims is patient and family-centered care and patient engagement. And what the Picker Institute has done with the Always Events and the Always Experience, I think, is to say to all of us, while we've made some progress, we have not made enough progress.
One example of an Always event that has been designed and implemented by Henry Ford Health System is dementia screenings for all patients 70 years or older. By conducting this simple screening during their yearly physicals, providers will be able to identify those patients requiring additional assessment in the early stages of the diagnosis, allowing for early intervention, open communications, and shared decision-making.
The concept of Always Events evolved through a process that involved distilling down to its essence the 8 principles of patient-centered care, and then moving beyond to a new approach and a new operating principle. So, as a bookend to Never Events, we established Always Events and Always Experiences.
Through its research, the Picker Institute identified 2 major themes powering the Always Events initiative: communication and care transitions.
That always should happen. There should be the best of communication, the best of our clear goals, and the best way that we'll solve this problem.
And that also can involve all of these disparate people all working for something that really is pretty obvious, which is when you're a patient, you ought to receive, you ought to expect, people ought to want to provide an optimal patient experience.
In its 27-year history, the Picker Institute has been a powerful force that has changed healthcare ensuring the voice of the patient will be heard even as the procedures for providing care evolve. Beginning with the principles of patient-centered care and evolving to always events, the Picker Institute has cemented its legacy as an engine of positive change in the way healthcare is delivered. Overseas, Picker Institute Europe, founded 12 years ago by Harvey Picker, is today a high-profile charity committed to improving the healthcare experience for all patients. In 2013, the Picker Institute will close its doors, handing off its programs to a stellar array of healthcare organizations committed to carrying on its work. One of these organizations is Plaintree.
It's a philosophy of how you deliver care to your patients, how you engage your staff in that, how you make sure that they are truly in touch with what patients and families' needs are. And that works anywhere.
Patients haven't changed. For years, patients have told us what they want and need from healthcare. It's the healthcare system that needs to change. And today, that change is gathering speed and momentum. Picker Institute has been an important part of that change. Our board and staff are very proud to have been among the leaders of the patient-centered care movement and to be able to add always events and always experiences to the roster of patient surveys, the 8 principles of patient-centered care, a distinguished group of Picker Award recipients, and a robust research agenda that has supported more than 200 projects dedicated to advancing patient-centered care.
We will always attribute this work of always events, always experience, and patient and family-centered care for that matter, to the original work of Harvey Picker and to the work, the contemporary work of the Institute, because they have done really remarkable work, and we're going to be respectful of that.
While Picker Institute's work is done, the greater work goes on, and the goal won't be reached until all Americans can rest assured that if and when they become patients, their experience will always be of the highest personal and clinical quality. At the heart of this mission are the words Harvey Picker spoke nearly 30 years ago. Understanding and respecting patients' values, preferences, and expressed needs is the foundation of patient-centered care.